Case number 10. A 30-year-old woman with sickle cell disease comes to the emergency room complaining of chest pain. Cardiac enzymes and exchanges suggest a myocardial infarction. What is a unique aspect of myocardial infarction in patients with sickle cell disease? A. It is typically due to atherosclerotic coronary artery disease. B. It frequently occurs without significant coronary artery obstruction. C. It is usually related to severe hypertension. C. It is always preceded by chronic chest syndrome. Correct answer. B. Myocardial infarction in sickle cell disease often occurs in the absence of significant atherosclerotic coronary artery disease. The pathophysiology is thought to involve microvascular occlusion by sickle cells and chronic anemia, leading to myocardial ischemia and infarction. This differs from the typical myocardial infarction seen in the general population, where atherosclerotic plaque rupture and thrombosis are the primary causes. It's crucial for clinicians to recognize this difference, as patients with sickle cell disease may present with myocardial infarction at a younger age and without traditional cardiovascular risk factors.